Good afternoon. Thank you for joining us today to explore why the COVID-19 global pandemic is proving so disproportionately deadly for the African American community here in the United States. I'm Dr. Cheryl Healton, Dean of the School of Global Public Health at New York University. We're grateful to have as our co-host NYU DC's Brademas Center. Today, I am privileged to be joined by the Honorable Alma S, U.S. Congresswoman for the 12th District of North Carolina, Dr. Melody Goodman, Associate Dean for Research and Associate Professor of Biostatistics at NYU GPH, and Dr. Emmanuel Peprah, Director of Implementation Science and Global Health and Assistant Professor of Global Public Health at NYU. Welcome, everyone. As Dr. Anthony Fauci said recently, health disparities have always existed in the African American community, but with this crisis now, it is shining a bright light on how unacceptable that is. According to a new analysis by the Washington Post, majority Black counties have 3 times the rate of infections and nearly 6 times the rate of deaths as majority white counties. I'd like to begin today's program by asking Dr. Melody Goodman, whose research focuses on social risk factors that contribute to health disparities among underserved communities and urban areas, a question to help us put this situation in context. Melody, can you please help us better understand why African Americans are so vulnerable to COVID-19?
Unfortunately includes many Black and brown folks because of their disproportionate burden of many chronic diseases such as diabetes, asthma, hypertension, which put them at higher risk for mortality from COVID. So they're both at higher incidence. They have a higher risk of incidence of getting the disease, but they also have a higher risk of mortality when they have other comorbidities. And that's partly why I think we're seeing this disproportionate rates in African American communities.
Incredible answer. Great. This is a good segue to you, Congresswoman Adams. As fate would have it, today is the projected peak date for the epidemic in North Carolina. Can you please speak to what you're seeing firsthand in your district, which comprises Charlotte and Mecklenburg counties?
Thank you, Dr. Healton, for allowing me to join you today. Thank you for all the great work you all are doing at NYU. I think about Dr. Martin Luther King Jr., who said that of all of the forms of inequality, injustice in healthcare is the most shocking and the most inhumane. And so when we look at where we are today with COVID, first of all, I've got to say, being in the U.S. House of Representatives, that this issue is not a partisan issue. It is a life or death issue. So it doesn't matter if you're a Democrat, Republican, or you claim no party affiliation at all. But there is a saying in our community that when white America catches a cold, Black America catches pneumonia. And so that's been true with this virus. It's revealed that the Black community has known what we've known for a long time, and you've just heard some of it, that the health outcomes are further complicated by this. And so I just want to say that in terms of my district right now, we have 152 cases, including 19 deaths. As of this morning, the state of North Carolina had over 5,000 cases, 117 deaths. We've had almost 68,000 tests. We make up in the state as well, in this county, 50% of those confirmed deaths. And so that's very concerning to us, despite the fact that African Americans only make up 33% of the population here. So when we look at other places across this country, the statistics are pretty much the same. Black and brown people are dying at greater numbers than the populations. You can look at Louisiana. 70% of the deaths have been African American, only 33% of them make up that population, and so forth and so on. It's true as well for Chicago, for Alabama, and other states as well. So those are just the things that we're noticing. And so people are very, very concerned, not only because of these wide disparities, but because the numbers continue to grow.
Thank you, Congresswoman. Dr. Peprah, you've devoted your academic career to examining what, why, and how some evidence-based interventions work in some populations and not in others. From your perspective, can you please comment on the reports that African-American men who follow CDC guidelines to wear masks for fear of being are failing to follow guidelines for fear of being profiled by law enforcement? Is there a need for culturally tailored interventions that could better safeguard the Black community from the spread of the virus?
Thank you so much, Dr. Healton. And I'm delighted to be on this panel talking about this very important issue. Yes, there is a need to have culturally sensitive training in terms of addressing this issue for the African-American community. Unfortunately, as my colleague, Dr. Goodman, has stated, there are significant disparities in the African-American community. Right now, we're at least 12 to 18 months away from a vaccine. That is one of the key ways to prevent this particular disease. Without that particular vaccination or vaccines, we have to develop certain interventions. Social distancing has been used as a primary way of stopping the spread, but now there is a need for people to wear masks. Unfortunately, there has been incidences within the media that highlight the fact that African Americans, specifically Black men, are being profiled for wearing masks. So I have to say that we have to really address this in a very culturally sensitive way to make sure that African Americans are not, unfortunately, having to have higher rates of infections because they cannot protect themselves from doing the essential thing that anybody can do, which is wearing masks.
Yeah.
That's very helpful. I'd like to ask another question that each of you can weigh in on, and then we'll open it up for Q&A to the audience members. First, it has been argued that the devastating impact of COVID-19 is ultimately caused by the racial character of inequality in the US. In public health, we frame this as the social determinants of health. Could each of you give your perspective on this? Start with Dr. Adams, move on to Dr. Peprah, and with Dr. Goodman.
We thank you very much, Dr. Healton, for that question. We do have these determinants, the social determinants of health now, and I think we can sometimes rely on those, but I don't think we need to use those as a crutch, particularly in this situation in the time of COVID. Now, I have tried to frame my work in the Congress around what I call the 4 H's, housing, hunger, healthcare, and even higher education, simply because that's been my background, but education in general. And I think when we look at some of the problems and some of the issues and challenges that we have in our community that we translate as social determinants, such as the lack of affordable housing, people living in really confined, closed spaces, people not being able to afford housing. We have a situation here in Charlotte where we have individuals who don't have adequate affordable housing. Lots of things have caused that, including, what we call redlining and other kinds of things, bringing a lot of development into our communities. But we also have a lot of hungry people. There are 165,000 folks in my district who are food insecure. 50,000 of those are children who go to bed hungry every night. So when we look at what's going on, that people cannot survive without food. And I think that these all ought to be basic constitutional rights, just like healthcare. I believe it is a constitutional right. I tried to get it put in the Constitution as a basic right. I think we need to look at it that way. We have so many people without health care. The Affordable Care Act gave us an additional 500,000 folks right here in our state who didn't have health care to have it. Now, when you look at this situation with COVID, that is adding to the problem. It's exacerbating the problem, and especially when you look at the fact that thousands of people are out of work. A lot of the healthcare was connected to the jobs that they have that they no longer have. But for people in many of our communities, healthcare is a problem, housing is a problem, not making the kind of wage that you need to make. People are living below the poverty line. A lot of folks are. And as Melanie said earlier, you know, we have people living in crowded conditions and so forth. But all of these things, I think, add the fact that you know, we need to try to make sure that people get the right kinds of, the kinds of education that they need and so forth. So all of these things, I think, exacerbate the problems that we're looking at today in the midst of COVID-19.
Thank you, Alma. Dr. Peprah?
So I think that Dr. Adams has put it aptly. The 4 H's are very, very important. Even though we view this through the health disparities and social determinants lens in terms of, as a researcher, we know that housing is a significant contributor. There's been published studies that looks at homelessness and housing and how it's significantly associated with, unfortunately, mental health issues. And in fact, housing has been shown to be a significant determinant of a whole host of diseases. So COVID-19 not being any different from some of these other diseases due to its infectious nature. I think that in terms of addressing this within the African American community, there needs to be priorities to set. But I also want to point out that within not only the African American community, but also we see rates in terms of individuals within the Hispanic and Latino community also that are disproportionately
Right.
have mortality due to COVID-19. So I think that there needs to be a deeper dive into many of these issues, how they really affect COVID-19, how they affect, for example, access and help to healthcare, as Dr. Adams has pointed out, and sort of those particular outcomes and how they really affect minority communities, not only within New York City, but also within Charlotte, North Carolina, Alabama, St. Louis, Missouri, and all across the country within the United States. Because unfortunately, these statistics are not just based in one location. The statistics are actually affecting African Americans across the entire United States.
Very good point. Dr. Goodman? So we know in public health that place is a real key determinant of health. Where you live, work, play, and pray have really profound impacts on your health outcomes. As a biostatistician, if you give me someone's zip code, I can likely predict a lot of the health outcomes they're seeing in their community, more than if you gave me someone's genetic code. We just don't know enough yet about all the genetic information. And particularly when you think, this is why I think it's a place and not necessarily a race issue. It just so happens that we still live in a really residentially segregated country. And so the places where our predominantly Black and brown folks live are seeing the highest rates of infection. It also has to do with people who live in multi-generational households. So 3 to 4 generations of family living in the same household. But also, particularly in New York, one of the things that they say is to socially isolate yourself or quarantine yourself, what most of us wouldn't do for another bathroom in New York City, right? Like the idea that you're socially isolated, use a separate bathroom and use a separate kitchen if you have them. This is the whole idea behind masks. The information we're giving to the general public doesn't fit every specific population, right? And as a Black man, am I more concerned about COVID or being shot by the police? Is that a risk judgment that we want people in our community to have to make when they're dealing with a pandemic? And so I do think we really have to think about the way place impacts health. The American Public Health Association and other organizations have been really pushing health in all policies type of agenda, where we really think about how all the policies we have impact one's health. What we're seeing in COVID is really racism in our country playing out in a way that I think people really did not, I shouldn't say people, because those of us who study disparities sort of knew this up front, but I think to the mainstream public, they're really sort of surprised at how this is playing out.
That's great. And Nina, are you managing the question flow here?
The questions are coming from Tom McIntyre.
Okay, is he, Tom, are you going to restate them or you want me to pull them from the file?
I can restate them.
Okay, that would be great. I appreciate it.
Should we start now?
I think we're ready.
Okay. So we have, what role can HBCUs play in addressing the COVID-19 pandemic?
I know that's made for Dr. Adams.
That's a Alma Adams question, I think. Well, and let me just say I'm a proud two-time graduate of the North Carolina A&T State University in Greensboro, North Carolina. I'm a 40-year retired professor from Bennett College in Greensboro, North Carolina. So HBCU runs through my blood. They took me in, poor Black girl from the ghetto of Newark, New Jersey, and molded and shaped me. And so now I don't walk the ghetto streets of Newark, I walk the halls of Congress. But having said that, I am the co-founder of the bipartisan HBCU caucus in the Congress. We're doing a lot of work to educate folks. But I think that one of the things that I'm seeing now, as we have had the particular situation in New York with COVID and running out of space in terms of hospitals and so forth, that it's very possible, and I know that Howard University is looking at this, where my youngest grandson is, at maybe setting up some field hospitals on those campuses. You know, we have only 3 campuses that actually have had medical schools, and so I think that that's one of the roles that we can play, particularly now as we're looking at this virus moving. And I'm just so fascinated with how they're tracking this thing like a storm. Maybe the medical people can help me understand it. You know, as I hear them talk about it, I say, it's like the weatherman saying, well, it's going to be here tomorrow and then it's going to move on into your area. But I think that that's one of the things that one of the major things right now, because I think the virus is actually controlling what we can do and what we can't do. And we're looking at now whether or not students are going to be able to come back on our campuses, not just HBCU campuses, but all campuses, because of the social distancing and all the other kinds of things. So, but I think that that's one of the major contributions, and maybe even in some of our areas on the campuses, in our science departments and all those, maybe we can find that virus. You know, we've got some of the most gifted and talented students, and no fault of or no slight on NYU. Some of the most gifted and talented students we find on HBCU campuses, as well as many of the great faculty who work there as well. So I think those are some of the contributions that we can make. And then, of course, our students are helping to help the young people who are now being educated at home. Everybody's homeschooled now. And so we have some really strong education departments, as well as science programs and so forth.
Thank you so much, Congresswoman.
Can I just add to that? I
Certainly.
think one of the things HBCUs can really do is fill this education void. There's been a lot of rumors and misinformation, particularly in the African-American community, about COVID, and particularly in communities where government is not a trusted resource. So right now I'm telling everyone, go to the CDC, go to NIH, go to your local health department. But for people who don't trust government, it would be nice to have some trusted sources give them really reliable information about the disease in real time. And I know that's hard with information changing, but I do think the messenger is as important as the message.
Yeah, let me just say, you're exactly right. But I think one of the things that we talked about, I think yesterday, was that it was something was put out somewhere that Black folk couldn't get this. And so while we're educating, I think that we need to make sure all you have to do is look at the numbers and see who's dying and so forth. And you see that that is not the case. But sometimes we get misinformation. So I think you're absolutely right. Now, I certainly agree with that.
That's a good point.
I think that in terms of HBCU, just to piggyback on Melody's point, in terms of education, they can be instrumental in training the next workforce. I myself came from the Harriet Medical College. That's where I got my Ph.D. So Dr. Adams, I agree with you in terms of the talent that is at HBCUs. And I think that there's a pre-COVID and then there's a post-COVID mind frame that we're going to have. And as the School of Global Public Health, we've been thinking about basically what is going to be that post-COVID society. And we know that we have to ramp up our public health facilities. We need to train more individuals in public health. I think this virus has shed light on the importance of the work that people do in the public health realm. And I think that HBCUs, Howard, Meharry, and all these HBCUs have a unique role to really gear up and put forth a cadre of individuals who are well trained in the public health sector, who can reach out to those minority communities so that when these issues start, we can really start to address them so that we don't see these particular disparities. We really need that workforce to exist within the United States that it has not existed to a level before after this particular pandemic.
Thank you very much. Tom, do you have another question for us?
Yes, so outside of New York State, grocery delivery services like HelloFresh, Amazon, FreshDirect are not required to accept EBT cards as payment. This forces all lower income families to shop in grocery stores, potentially exposing themselves and others. Is there consideration for a federal law to require major grocery delivery services to accept SNAP benefits?
Let me just, I'm assuming the question is for me. Listen, I sit on the Agriculture Committee. I'm Vice Chair of Ag. And of course, food is one of the things that we talk about, whether it's SNAP with making sure that people are fed. And that is so important. But I also think that things like that, not accepting people and that's just discriminatory. And we do need to fix that. And we're talking about trying to make sure that the access is there for individuals. You know, people are not poor because they want to be. But I think we're in a situation now where we have to extend that outreach and that support for everyone so that they have that opportunity. Now, we have a stay-at-home rule just about all over this country. And so if you've got these companies and most of your restaurants are not in the business of having people to come in, so they're taking their services out. And you know, poor folks need to eat too. So I just, so let me just say that if we don't have it moving, you can count on me. We're gonna make sure that I believe we're working on that in a sense. And let me just say that one of the problems that we have is that politicians sometimes don't put themselves in the place of the people who are out there. And I think we need to do that more and to have more compassion for folks. You know, if your belly's full, then you don't think about someone who doesn't have that food. And sometimes we just don't do enough of that. And we've got to be better at considering all people and respecting all people and the needs that all people have.
Does anyone want to add anything to that before we move on to another question? Okay, Tom?
When our country moves into a period of recovery from COVID, what do you think or hope the key changes will be or should be in reducing these disparities in the African American community?
Who would like to go first?
Well, I won't keep going first. I'll yield to.
So happy to.
But I do have some thoughts on it.
Okay. Emmanuel's going to go first, then Melody. Go ahead, Emmanuel.
Sure, happy to provide some thoughts on it. I think that we need to address several things. One of the things is we really need to think about the level of insurance that exists within the country. So as the literature is coming out, people have seen that COVID-19 is also causing damage, not only to lungs, but other internal organs, including kidney. And in fact, I believe heart and several other areas, multi-organs have been implicated. So once people recover from this particular disease, they're going to have chronic conditions that will need further medical treatment. So I think that all the effort that we've put into making sure that people are able to survive this disease is going to really not pay dividends if in the end, 2 or 3 months later, a person dies from a stroke or some other disease that could have been prevented if they had medical insurance. So I think that within, after this pandemic is over, we really need to look at our healthcare system, look at what inequities exist, and make sure we're starting to address those. From my perspective, I think that universal or some sort of healthcare coverage is very, very important to make sure that people have access and not to healthcare access and can be able to follow up with doctors and so forth and so on. Many of these inequities exist because people do not have access. And I'll turn it over to somebody else for some more comments.
Melody, did you want to amplify?
So I hope that post this, we treat everyone fairly, and we really think about people's ability to quarantine. And the same way that we're offering hotels and the like to healthcare workers, I hope we do that to people who live in high density housing so that they're able to separate from their family so that we don't continue to see these clusters within family, which has profound both physical health issues, but mental health issues for everyone in their family. I hope that we make strong investments in our public health infrastructure and also our public health sciences. Wouldn't it be great if we could tell you right away how many days you'd had to stay in your house? Wouldn't it be great if we knew a lot of these answers scientifically? And wouldn't it be great if we really had been investing in our public health infrastructure all along so that we have the ability to contact all the things that we need to do post this epidemic? It would have been nice to have all of these things in place pre-epidemic.
Tom, oh, did you want to add to that, Elmo, before we
Yes,
move on?
yes, I do. I think
Sorry.
we're going to have to put more funding into high-risk populations and communities. I agree with Melanie in terms of the housing. I think we have to put more funding in mental health resources, as well as our health centers. I think that we also have to make sure that we are putting funding into these needs that we've said that many people, black and brown people, have in terms of their of these health disparities that exist. But I also think, after we're talking about posts, that there's some things we need to do right now. We need to beef up this testing. It needs to be focused. We need to have contact tracing, immediate, rapid testing, PPE. We should never have our frontline workers, particularly those who are working in hospitals and other places, whether it's grocery stores, all these other places, unprotected, and yet they're out there protecting us. And then we got to get this data. We really need to have data so that, and we need to do that, we need to do it now and later. So I think, again, if we can diversify the funding that we put in, if we find funding for the things that we want to do, we see that we know now that this is serious, and that's the only way we're going to be able to make a difference for people who live in these communities, minorities, black and brown folks.
That's great. I'm ready to start a new 4-H club after this.
Okay.
Tom, do we have another question?
Yesterday, Dr. Oz made an unfortunate comment related to K through 12 education sacrificing children as we move forward. As a public school educator, how do you all think the reopening of schools being on the second phase of the president's re-entry will actually affect the possible spread of the virus?
I'm happy to take that. I think Dr. Adams has pointed out something very important. We need testing. We really can't do anything until we have testing. From the start of this unfortunate pandemic, we have under-tested. We don't even really know the number of individuals that are positive because we're really so under-testing. We need to ramp up testing significantly. I have a daughter and she's in university, and I would be hesitant for her to go back unless there's a significant amount of testing and we just know the incidence, just know that basic public health knowledge about the virus, the incidents, and all those things that we don't really have. We need antibody testing. We need to ramp up the testing capabilities of this country to really, to be able to say, to make good, sound policy decisions. It is unfortunate, the statement that he stated, and I think that we cannot make any decisions moving forward unless we have had ample amount of testing so that we understand sort of how best we can move forward, and not make sure that we are able to, number one, stop the spread of the virus and save lives.
Yeah. I just believe that I'm not putting a lot of confidence in all the stuff I hear coming out of the White House. I'm just gonna be real honest about that. But as a parent, as a grandparent now who have college age grandchildren, I have to agree with the doctor here that I would be very reluctant. I mean, I think parents are going to want some real assurances that my child is going to be safe. But then we also have to think about how children interact with each other. Do you think they're going to walk 6 feet apart and not hug and get close? That's just not going to happen. And I just don't think we should risk too many people have died already because we were not responding in the way that we should have in the time frame that we should have. And that's just fact. And we know it. People can say that's, it's China, it's been everybody else, but we have not done what we should have done. And for us to want to reopen and send kids back to school like that, you can open the schools, but I'm not sure the parents are going to send them. And you can open the colleges, and I'm not sure that the parents are going to send them either. And again, I think we have to prioritize the safety of all children. But to just do that without thought of what really might happen, and then to open this virus back up. But I don't think there are any clear assurances right now that it is safe to do that, and it will be safe in a few weeks or maybe even in a few months or when school starts in August.
Do you want to add anything, Melody?
I think, this is a challenge, and I think people look at some of the data and feel like children are not as impacted. And I don't know whether that's believable or not, but one of the things I think we have to really think about is the way our society is structured. Even if you send children back to school and they're living with their grandparents, you are putting those older adults who we know are high risk at a higher risk of contracting the disease. And so I think we have to think about all of the consequences of every action that we plan to take in the future. And without really knowing what % of our population has had the disease, and also how long immunity to this disease lasts, we just don't have enough scientific evidence to really open up anything at a mass level.
I agree with all of that. So just to throw my 2 cents in, that's a very good point. Tom, do we have something else you want to roll out for us?
Sure. How should we evaluate the trade-off between surveillance and measures preventing the spread of the virus, like contact tracing?
I'm not sure I think there is a trade-off. We need to do both. We need strong surveillance systems. And then once someone is identified, we need to do all the contact tracing. I mean, I think the reason why we're having such a hard time now is because we're at a level where it's, particularly in New York, that it's community spread. And so it's really hard to identify all the people you've been in contact with and the like. But hopefully we'll get to a point where the numbers are much lower. And then when we identify someone who is positive for COVID, we can really go through and contact trace. I think this is where technology is going to be helpful to us. I don't know how many of you can remember how many people you pass every day, but particularly in New York City, that is a hard challenge because I don't even know half the people that I walk past. But I do think our mobile phones, and there's some other ways that we could use technology to really support public health. And so I'm going to get back on my soapbox. This is where we have to innovate our public health science. We have to take it a step further from how we normally do things, because we need to do everything at a grander scale now. And I think we have the technology to do it. We just need to figure out how to make it work.
Yeah.
It's great. Anybody want to add to that? I will just,
Yeah.
sorry, go ahead, Alma. I'm
No,
sorry.
I was saying I agree with her 100%. Listen, we are really now dependent on technology. It never even crossed my mind that I'd be sitting here in a conference this way. I didn't really know what my computer could do anyway, so I'm learning a little bit about it, even learning how to draw on it. But we're forced to do that, and of course, I think it's going to make us better. But yes, it's going to integrate that, which is really what we need to be doing.
And I just add that apropos that comment, we're not talking about single tests. We're talking about repeat testing.
Right.
We're talking about family kits being sent so that families will be able to differentiate positive, negative, and exactly the point Melody made, that there have to be alternatives to separate people who are infected from those who are not, or we're never going to get a handle on this. Never, never, never. Yeah. So Tom, next question.
There was a suggestion that the issue was not one of race, but of geography due to economic segregation. Have wealthier minority communities fared better than less wealthy minority communities?
Well, I can tell you that I can just say no to that. Our communities have not fared better. We have a crisis here in my district with upward mobility. There were studies done to say that a child born in our communities born in poverty would never be able to elevate themselves out of that, simply because of all of the conditions that are connected to that impoverished situation. Many of them we have already mentioned. So I don't see a situation overall where the Black and brown communities have really fared better. I mean, when you look at some of the statistics in terms of housing and schools and all of those things, a lot of our folks, for example, many people, as we've seen them on the front lines out here, still going to work, considered to be essential. If you're so essential, and they are essential in terms of you got to keep the stores open for people who need to go buy food. So if you consider that to be essential, consider those challenges and issues in these communities as essential too. And let's do something about it. And I say that to my colleagues in Congress as well. If you consider these folks to be essential, and they're coming out and they're putting their lives on the line here, working in grocery stores, running the bus, doing all the other things that they do, and still not even making a living wage too. I mean, I'm still on that soapbox, because I think that that's one of the things that will help elevate people. People need to earn people are working 2 and 3 jobs and still not making enough to feed their families. And of course, now a lot of those folks are out here, many of them without jobs or having to go to work, and they're getting sick. They're getting sicker. And I'll tell you, African Americans, we're tired of being the sickest people. That is, that's something that we can do something about, and we need to.
I mean, want to add? Go ahead.
I think the unfortunate part of that question is that there are not that many wealthy African-American predominantly African-American communities in this country. The one that I think of off the top of my head is Prince George County, Maryland, and I don't know their statistics off the top of my head, but what we do know about upward mobility in the African-American population is that it's usually one person within a family who is able to be upwardly socially mobile. So even if you have moved yourself to a higher social economic status, but most of your family are working class, meaning they're still working for the post office and bus driving, then you still are at a higher risk of contracting disease if you live in the same residence as those folks. So I think it's hard to answer that question, because we really don't have enough data. We really don't have, structurally in our country, we don't really have enough wealthy, predominantly African-American communities. So in order to address that, you have to fix structural racism.
Tom, do we have another question? I see we have a lot there, 37 in the queue.
So a lot of people are facing economic hardships, which forces them to go into work despite displaying symptoms or being at risk. What are your thoughts on this, and how can we best help these communities at this time?
Alma, you going first?
Well, I think the first thing that we need to make sure of is that people who are going out to work in what we're calling essential jobs, they've got to be protected too. And we're finding people who are going into these jobs, and I mean, I watch CNN a lot. I mean, that's one of the things you can do in between all of the computer stuff. They don't have masks. They don't have what we're calling the PPE. They are not, and employers, many employers weren't even insisting on it. They weren't even providing that. So I think that's the first thing you have to do is you've got to protect them. You've got to also, I think, make resources available to those communities. We're having a lot of discussion here in Charlotte about the testing and many of our folks in our communities, because you don't know who's walking around with it. They may look fine, feel fine, and yet they're carrying it. So I think you need to test everybody. I mean, that's just my personal thought about it. You'll never know. We've got to certainly beef it up. And we're even looking at mobile testing. I mean, we should be. Take the testing to the communities. Many of these folks can't get to where some of the testing sites are. So I think we have to look at all of the surroundings and the things that are impacting these communities and make sure that they have the access to the food, to the housing. All of those things, I think, are really going to be essential in helping us to move past this.
Okay, in the instance, we have so many questions. Do you want me to take questions and have one of you answer each one of them? Okay, Tom, that's how we're going to do it from now on, so we have greater opportunity for participation.
Okay. How important is it to open ACA exchanges in those jurisdictions where it remains closed except for qualifying events?
I'm going to give that one to Alma because I know it's a public policy question.
I don't think that's important. What's important right now is embracing this pandemic in a way that we can beat it, level it off, or do whatever they're talking about, so that, and then getting a what do you call
Vaccine.
it? A vaccine to make sure, because I'm hearing now, I'm not that kind of doctor, got some here, but I think that we're told that it's really going to be the vaccine ultimately that will get us to where we need to go. So I think that we're going to have to put those things aside for the moment, enjoy them on TV, enjoy them on whatever the little computers and things that you have. I just don't think that we should put people at risk, and that I believe that that's what that would do. So that's not as important to me. I don't think it's as important to the people. And I think as a policymaker, I think we've got to think beyond that. We've got to lick this virus first.
Thank you. Next question, Tom.
Robin Hamilton just points out that PG County actually has some of the highest rates of COVID in Maryland, to Melody's comments.
Okay.
Can you expand on or share your perspective of how implicit bias, white supremacy impacts the handling and care of Black and Brown people before and after they have been diagnosed in terms of medical care?
Melody?
Can you repeat the question? Sorry.
Can you expand and share your perspective on how implicit bias or white supremacy impacts the handling and care of Black and Brown people before they have been diagnosed, and in terms of medical care?
So I think how we structurally set up testing, who can get a test, that's a structural system. Is it accessible to people? Is it a place that they can get to? And then when they get there, are they qualified? Because now we have requirements for getting tests. I know in New York State, they're trying to put more testing in minority communities to try to make it more accessible. And then when we enter the healthcare system, are we treated the same way? There's some evidence to suggest that doctors believe that African Americans have a higher tolerance for pain. And sometimes when people report symptoms, those symptoms are not treated as if they are valid, as if people don't really know what they're feeling. And so if you have those types of bias where you don't believe what a patient is reporting to you, then how can you treat that patient adequately just based on looking at them, particularly when we know that a lot of the symptoms for COVID vary by person. It's not the same set of symptoms in everyone, and the timing of the symptoms are not the same, and the level of severity of the symptoms are not the same. And so if you are not able to take people at their word for how they feel or what's going on with their own bodies, then you're likely to introduce some bias into how you're treating different people.
Yeah.
Cheryl, comment
Yes,
on
please go ahead.
Melody, that's a great point. I wonder how that implicit bias has affected African Americans in terms of their access to the healthcare system. For example, when they had those symptoms, did they wait until it was past the stage where they had to go to the hospital instead of going first as soon as those symptoms appeared? So I wonder how that has really impacted, the mortality rate in the African American community. So
It also has to do with insurance, right? So
Yeah.
if I have insurance, I can go to the doctor when I have a sniffle.
right,
If I don't have insurance, the bar for what it's going to take me to be willing to go to a doctor and pay that money out of pocket is going to be much higher.
Yeah. Yeah. And if I could just add, I mean, that was one of the things that we tried to do in the stimulus package to ensure that testing was free. Didn't matter whether you had health insurance or not. What's missing is treatment. So if you go and you're tested and you are positive, then how are you going to be treated? So you're right, the insurance factors in. But in terms of that bias, I had a discussion with some doctors just last night about the biases, those kinds of things that contribute to some of the problems that Black women are having in terms of the high rate of deaths during pregnancy and after and so forth. Doctors not listening to your body, and you talk about pain and things that you have, and they'll dismiss it sometimes. But I don't know that I've heard the thing about we tolerate more pain, but yeah, that may very well be the case too. Yeah.
Very good. Excellent answers. Tom, next question.
What advice or message would you give to young people from minority groups who are entering the professional world in the next 5 to 10 years, who are seeing their families suffer and want to make an impact and improve public health in their own communities?
You should study public health. It is a great, interesting, and fascinating career, but it also has a real important impact on your own community and right now the entire world. So I think many people sort of bump into public health sometimes accidentally, but I hope now that people are hearing the word public health and epidemiology on TV on a regular basis and flattening the curve, that it will encourage more people, and particularly from diverse backgrounds, because I think in public health, we need to really work on diversifying our public health workforce. If you have experience, you're gonna tackle a problem differently. If you understand the situations that people are living in, then you're gonna approach your interventions differently. And so it's really important for us in this moment to encourage a diverse set of our youth to really consider public health as a career option. We really need diverse perspectives, and we know that genius is everywhere. It's in the ghettos, it's in our barrios, and it's on our reservations. And so we need to pull from that genius, and hopefully some of them will pick careers in public health.
Yeah, wow. Can't agree with you more.
There you go. Yeah, it's terrific. Tom, another question?
Do you think the pandemic will encourage any states to increase insurance coverage by adopting the Medicare expansion under the Affordable Care Act?
Yeah, if I could comment, I am totally embarrassed about North Carolina. I've lived here for many years. I've served in 3 elected positions, all representing North Carolina. And I have a district of about 830,000 people. There are 9 million or so in our state. But the point is, everybody should be able to have the health care that they need. And when we were able to expand Medicaid, no cost to the state, when we were able to expand Medicaid, we did not. Other states have done it, and of course, that's where our money goes now. That means that we've got still another 300,000-400,000 people before pandemic who were without health insurance, who could not go see a doctor or wasn't comfortable, who then would flood our emergency rooms. I grew up without health insurance. My mother didn't have it. I had a sick sister who died a week before her 27th birthday. And we would get up in the middle of the night, 2 and 3 o'clock in the morning, going to the emergency room. So I understand how it is not to have health care and what you have to do when you don't have it. So I just employ not only my colleagues in the U.S. Congress, but all elected officials across the state, this state of North Carolina, but other states as well who have not expanded, because look at what you have now. Thousands of people, millions without jobs. Many of those jobs are connected. Their health care was connected to the jobs. They don't have the jobs anymore. So that means now that those numbers have escalated in terms of people without health insurance. It's a terrible thing. And I agree with King when he says it is tragic and it is inhumane to not have it.
Very good. Tom, one more question I think we have time for, maybe 2 at the most.
Do you have any insights into the way some of the disparities we see in the US are being seen on a global scale?
Wow.
Emmanuel?
So I think
that is a very good question. Melanie, did you?
Well, I was just going to say, I think what we're seeing is that COVID disproportionately impacts vulnerable populations. Yeah. And in different countries, who is in the vulnerable population group is different. So when we saw data from Italy, it was the older population, older adults that were most vulnerable. But in the US, our vulnerable populations include older adults, it includes racial and ethnic minorities, it includes anyone who has been structurally disadvantaged. And I think you will see that play out across different countries. So I think what you're seeing is who in that country is vulnerable. And that's the common thread. And I think that's different in different countries just because of how we are structurally and politically set up.
Did you want to add to that, Emmanuel?
Yes, and I agree 100%. I think also that in terms of at least COVID-19, there has been a high proportion of individuals that are 60 and older that have succumbed to the disease just because of underlying health conditions. I think that perspective is still going to exist around the globe in many continents as this pandemic continues. So overall, we're starting to see numbers in terms of what it's going to be looking like in Africa. And I think that we'll have a clearer picture of it within the next few months or so, once we understand sort of the mortality around these particular, in these different global settings. But overall, I think Melody has an excellent point in terms of the disparity that's still going to exist no matter what context you're in.
Wonderful. And Dr. Adams, I'm going to give you the last word here on our webinar.
Well, certainly I agree with now my colleagues at NYU. We're working on a 4th package in Congress. Hopefully we'll have an opportunity to correct some of the things that we didn't see along the way. But I think this is a very timely and important discussion. COVID-19 has revealed a lot about our country that I'm certainly not happy about. But hopefully citizens now will come together and realize that we really have a lot of work to do across this country, even in my state and my district. And, you know, we keep hearing folks say we're all in this together, and we are, and we'll get out of it together, but only if we work together to do that. So I want to certainly tip my hat to you, Dr. Cheryl Healton, to the wonderful folks here, Melody Goodman and Dr. Peprah. Thank you so much for engaging in this conversation. And you got some brilliant folks up there, Cheryl. That's all I got to tell you.
We most certainly do. And we've got you in Congress representing not only North Carolina, but all of us, because we know your values and you're just the kind of congressperson we need. So thank you for joining us. And thank you, Melody Goodman. And thank you, Dr. Peprah. And thank you to our colleagues at the Brademas Center in DC.
Thank you all. Have a good afternoon. Be safe, stay 6 feet, and wash your hands.
There you go. I'm going to do it now.
Okay.
Bye-bye.